Welcome to Transforming Healthcare, the people behind the progress. My name is Joyce Shaw, Chief of Staff in the HSE Technology and Transformation Office. Today I'm joined by two key figures in the MedLIS programme, Dr Gerard Crotty, who's our National Clinical Lead on the programme, and Thomas Walsh, Technology and Transformation Laboratory Programme Manager. Together they're leading the national rollout of Ireland's new laboratory information system, a critical enabler of safer, more connected care. Thank you both for joining us today. To start us off, perhaps each of you would maybe describe your role on the MedLIS programme and your professional background. Gerard, I'll start with you if that's okay.
Yes, I'm Dr Gerard Crotty. I'm the National Clinical Lead for the MedLIS project. My background is I'm a consultant haematologist. I've been full-time consultant haematologist for 25 years in Tullamore on Mullingar and Portlaoise until recently, and I was for a period seconded to the project, and now I'm retired from Tullamore, and the MedLIS project is my main job. And I've had a long-term interest in medical informatics, and I've been involved in local and regional and indeed national committees over the years, but it's good to get actually involved in the project directly.
Great. And Thomas?
Hi, hello. My name is Thomas Walsh. I am the Programme Manager for Laboratory within Tech and Transformation. My own background is within laboratory. I worked for almost 20 years in haematology in University Hospital Waterford, and I slowly evolved, I suppose, into a more technical role, project management, and I suppose eventually ending up where I am as Programme Manager for Laboratory. And that role, I suppose, really primarily is around delivery of laboratory-centric projects. Our prime project and key project is MedLIS, but there's also projects like laboratory stabilisation and GPE ordering.
For those of us, Thomas, who are maybe a little bit unfamiliar with MedLIS, why is this National Laboratory Information System critical to modern healthcare?
Well, I think to understand MedLIS, you need to understand laboratory landscape in Ireland. And there are over 40 HSE funded laboratories within the state. And generally speaking, they're all a very, very, very high quality service. They're all generally aligned and accredited to ISO 15189. The but is, I suppose, that most labs really work in isolation. We've over 40 silos. There's little collaboration, there's little cooperation or operational cooperation between the sites. So we've 43 silos in short. The objective of MedLIS is to bring all those 43 hospitals and 43 laboratories onto one national laboratory information system. And the key really for MedLIS and the core of MedLIS is that system will be patient-centric and it will be clinician-centric. So whether you're a clinician in Cork, in Cavan, in Waterford, in Donegal, and anywhere in between, you have access to that clinical single national laboratory record for your patient. I guess at a lower level, at an operational level, laboratories have for a number of years, they've been calling out for order comms, an order comms system. And order comms will transform how laboratories operate their pre-analytical works. And it's a real, genuine, transformational, and it will be a real improvement for laboratories and how they operate.
You've both come from different, I guess, but complementary backgrounds, clinical and digital. How did your respective journeys bring you to work together on technology and transformation in healthcare? Thomas?
Well, I suppose as Programme Manager, my role, my focus is primarily on resourcing, it's on tasks, it's on timelines, it's on business cases, it's on documentation. So for me, I'm very appreciative of Gerard and Gerard's role as Clinical Director. And I suppose it opens doors and access to clinicians and clinical engagement.
And Gerard?
Well, the laboratory system in the first instance needs to be able to provide the correct patient results where they're needed. So it needs to be reliable, it needs to be available, and one of the advantages of a national system is that it can be available wherever it's needed, regardless of the current location of the patient. And I think from a clinical point of view, that's probably one of the ultimate benefits of a national system on multiple sites. It has to be safe, and there is a clinical risk management process to ensure that it is safe and acceptable to the laboratory clinicians and the clinicians throughout the hospital and indeed primary care during the implementation. And that's where the engagement on the ground is so important. And I think in terms of the engagement, the relationships and the two-way communication is extremely important, and also the structure. There is a governance structure which is regional, so that the appropriate decisions are made about ensuring that the system is fit for purpose when it goes live.
Thomas, from your experience leading digital implementations, how do you ensure that the clinical needs are front and centre?
Well, I would like to think in MedLIS we've clinical engagement throughout the programme and throughout the project. Both, I suppose, starting at site level, we've engagement with clinicians, with NCHDs, with nursing, with laboratory, with lab aides at site level, and that moves its way right up through the programme. At project board level within Dublin North East, we've clinical representation at board level. And then at national programme governance level, we've really strong clinical engagement there. So right the way through the project, I would like to think we have clinical representation and an opportunity for clinicians right across the spectrum of clinicians to engage and I suppose lend their experience and guidance around the build.
Gerard, can you share with us maybe an example of how clinical and digital collaboration helped overcome a challenge or drive progress on MedLIS?
Yes, well, I think the prime example we have so far in the project is the go live at Beaumont Hospital, our first go live, and that was a major operation, including all the people you've mentioned and many more from the national project team, from the hospital, from the vendor, and involved on the hospital site, the clinicians, both in the specialties throughout the hospital, also in primary care, the laboratory clinicians, laboratory scientists, and the ICT, and numerous other people. And it's quite a complex project, particularly as a first go live, and that was very successful. I went live almost a year and a half ago, and it's been a great success and many benefits which we've documented for Beaumont and for the patients and for the staff. So that would be the prime example I would have at this stage. And hopefully we can replicate that, and hopefully it might become easier as we get more sites on the system, and the benefits will actually show up to a greater extent, because a lot of the benefits are network benefits, where the patient data will be available if the patient turns up at a different hospital in the same region, or even ultimately in different parts of the country, and we'll see those benefits magnified as time goes by, just as we have with probably the leading national clinical system in hospitals anyway would be the NIMIS system, which has been a massive benefit. So we should see the same sort of demand even increasing for the system to be rolled out to multiple sites as time goes by.
How does MedLIS support the broader goals of the Digital for Care strategy? Thomas, if it's okay, I'm going to start with you, and then Gerard will follow.
Okay, thanks, Joyce. Well, I suppose I'm really confident that MedLIS aligns certainly those broader goals of the Digital for Care strategy. There's a handful, I suppose, that I'll just briefly mention. Number one is that concept of a national laboratory information record. I think it's really key and a key element of digital for care. Number two is the standardization of clinical and laboratory workflows. And another element, I think number three for me, would be the reduction in manual tasks. But primarily it's all about access for clinicians to laboratory results in a standardized approach, in a standardized manner.
Okay, and Gerard?
Yes, I think MedLIS provides the secure foundation envisaged in digital for care, and in particular there's a standard data model and one database, so it provides the interoperability that's needed so that the patient clinical data can be used wherever it's needed throughout the system, and that both meets the requirements of digital for care and also in the longer run our obligations under the European health data space in terms of having federated data available, interoperable for both primary healthcare uses and also secondary uses for public health, for innovation, for research. The system also meets the other key points under digital for care in terms of empowering the patient. Ultimately, the patient will get better care because their results are available and they don't have to have things repeated and so on. But ultimately, they will, in various forms, have access to their own data, and this meets another key aim of digital for care.
Gerard, in your opinion, what have you found to be the biggest challenges in implementing a national system like MedLIS, and how have you addressed those?
Well, it is a very complex rollout of a national system, the first of its type, given that the laboratories all have had their own separate database, mostly just siloed from other hospitals for perhaps the last 25, 30 years. So it's a huge culture change for hospitals, and change was difficult at any time, and that is one of the challenges. And the other challenge is actually the resources on site. Often labs have had trouble recruiting, and they may have key posts vacant. They may be outsourcing work simply because they don't have the resources to deal with the current demand. So they in some cases do need some support to be able to meet the requirements for the project.
And Gerard actually mentioned cultural change there, and I think it's really important we acknowledge that there is a fear amongst laboratories that they are losing control. So part of the programme, it's important for us to manage that as part of our change management and our change management engagement and overall, I suppose, approach to change, that we're really conscious and cognizant of those challenges and that fear and fear of loss of control, I suppose.
Gerard, what advice would you give to clinical colleagues who would like to contribute to transformation programs like MedLIS, but aren't sure maybe how to get involved?
I would say be curious and be available, put your hand up and volunteer for roles locally, regionally, nationally, through your professional bodies, wherever you find an appropriate role to slot in. We need a lot more involvement, and particularly as time goes by and we move towards the implementation of a national electronic health record, we're going to need a lot of involvement. And don't underestimate how valuable your clinical information, your clinical knowledge is, your clinical experience, and you have, I think there's kind of a curse of knowledge. We kind of forget that not everyone has that deep understanding of how to benefit patients, and that understanding is needed at all those levels in the organisation. So really just don't be shy and put your hand up and get involved.
And if I could as well just mention, people have said to me they'd love to become involved, but they don't have any IT, they don't understand IT. And I always stress, this isn't an IT project, it's about the service, it's about clinicians, it's about improving the service, not necessarily improving IT. So absolutely, don't let a fear of IT hold you back.
Thomas, what lessons would you share with others embarking on a large-scale digital healthcare programme like MedLIS?
Well, we're still, I suppose, documenting lessons learned from our engagements in Dublin North East, and we're going to take those lessons learned and apply them to our next region, which will be Dublin Midlands. So it's primarily around strong governance, that we've strong governance in place at a regional level, but also at a national level, that we've really good clinical engagement. And I think Gerard mentioned it earlier, it's so key, and it's one of the real key lessons we're taking away from Dublin North East: resourcing, and the sites are resourced. The project teams are resourced, Oracle, our vendor, is well resourced, but it's really to ensure we have on-site resourcing in place.
Thomas, before we finish up, is there anything you wish to add that we haven't perhaps covered about MedLIS?
Yes, Joyce, actually, there is a perception around MedLIS that MedLIS is a lab system. And, I always mention this when we visit sites. MedLIS isn't a lab system. It's a whole system-wide, while it's a laboratory information system, it's system-wide. It has an impact in community, with GPs through our GP ordering. There's a phlebotomy module. It impacts an administration within the hospital. So it's not a laboratory information system. It's a hospital-wide, it's a community-wide, it reaches out into the GP services. So it's a whole system-wide healthcare system at its heart, of which is the patient record.
Okay, and Gerard?
Yes, I think that it is a huge benefit also to the staff. For instance, in the hospitals, as the system is rolled out to more sites, staff, particularly non-consultant hospital doctors who move from one hospital to another, will find they already know the system. It's a national order of communications system, and it really is future-proof and there to provide that easy access to the patient data wherever it's needed.
Thank you both for sharing your time and experience with us today. MedLIS is a great example of what's possible when clinical insight and digital delivery come together to deliver safer and better care.